Okay, so I have Whitney here who's come into the office because she's been having problems with her vision, and you also have a canker sore. Is that right? Okay. So, what is your visual acuity without glasses?
Without glasses, it's 20/25, and then with glasses, it's 20/20.
Okay. Do you ever have pain in your eyes? No, no pain. Have you had any history of infection, swelling around your eyes, blurring at all? Nothing. No double vision.
No.
Okay, and I'm guessing you don't have cataracts.
No.
Do you ever use eye drops?
Not like normally, no.
When do you use eye drops?
Just if they're irritated.
And what kind are they?
The eye drops?
Yeah.
Just like normal, like, I don't know, what's it called? Like saline or something.
Okay.
I don't know.
Okay. Have you had a recent change in vision?
Yeah, it's been more blurry than normal.
Okay. When you're far away from things?
Yeah.
Okay. When was the last time you had an eye examination?
Probably like 3 or 4 years ago.
Okay. How long have you been wearing glasses?
Probably like 7 years.
Okay. Okay. Do you have a family history of vision problems?
Yeah.
Like what?
Like my mom wears glasses. Like for a long time, she's worn them.
Okay, but no like eye surgeries or anything?
No, I don't think so.
Okay. So I'm just gonna take a look at your eyes. Your eyebrows. Okay, your eyebrows are symmetric. What would you describe the texture of your eyebrows? They look pretty thin, like not coarse.
Yeah.
And they're pretty short.
Yeah.
Yeah, you keep them trimmed, it looks like.
Yeah.
You don't have any swelling around your orbital area. Do you ever experience tremors of your eyelids? No. You don't have any like flakiness or redness around your eyes that I can see. Your eyelids aren't turned inward or outward. Everything looks normal. You have fake eyelashes on? Yeah. Okay.
Yeah.
And do those ever bug you?
No.
Okay. And I'm just gonna look at your conjunctiva, which is just the skin around your eye. It looks pink. No redness, no swelling. Your sclera, so the white part of your eye is white, which is normal. Your cornea is intact. It covers your iris and your pupil. Let's see. Your iris is brown. Your pupils are equal and round. Then what we're going to do now is test your visual acuity. So I have that chart right there. And I'm going to come over here and stand over here, and I'm going to have you read this line right here. From left to right.
Okay.
E, D, F, C,
I think to me it says 2, and then P.
okay? Now the next line down.
F, E, L, O, P, Z, D.
Okay, and then the line after that.
D, E, F, oh my gosh, P, Q, P, B, C.
Okay. All right. Then I have this little chart. It's called the Rosenbaum chart. And so I'm just going to have you read this. Start off with this line right here and read what you can of it and tell me what it is.
This one?
Yep, the third to last one.
3, 7, 4, 2, 5, 8. And then it looks like an E, a backwards E. And then E like on its back, and then another backwards E.
Okay. Thank you. Okay, perfect. All right. So now what we're going to do is test your peripheral vision. So what I'm going to have you do is hold this card up to your left eye, and I'm going to hold it up to my right eye, and then I'm going to have my arm extended out, and you're going to tell me when you can start seeing my fingers, okay? So there's that.
On this side?
Yeah.
Okay.
Okay. I'm going to start over here.
Okay. No.
Okay, switch.
No.
Perfect. Awesome. Thank you. Okay. Now I'm gonna it's testing your accommodation, so the way your pupils accommodate when you look at things near and far. So I want you to look at this pen and then focus on it out here. And look back at it. And then focus out here. Perfect. And I'm just going to have the pen slowly come towards you. It's good. All right. So now what I'm going to have you do is cover one of your eyes and stare at a fixed point, and then cover your other eye and stare at a fixed point also. Okay. Okay. Perfect. Can you hand that to me? So real quick, this is ophthalmoscope. I'm just going to shine it in your eye real quick just to make sure that your pupils are reactive. And then I'm actually going to look inside of your pupil and look into your retina. So just going to... Yep, they constrict the light. Perfect. Okay. So I'm going to stand over here, kind of to the side of you, and I'm going to go direct, kind of at an angle towards you, and it's going to be like bright light in your eyes, okay? Okay, let's try this.
Yeah.
There you go.
There we go.
Okay. Good, perfect. Now your other one. Sorry, this is bright.
Yeah.
Okay, perfect. Thank you for letting me do that. Okay. So, we move on from your eyes and do your ears. Do you ever have any pain in your ears or ear infections or anything?
Mm-mm.
Have you ever had ear infections at all?
Mm-mm.
Do you ever have like weird discharge or anything coming out of them?
Mm-mm.
Do you ever have a feeling of spinning or moving around? Dizziness? Okay. Let's see. I'm just going to take a look at the outside and then I'll look in the inside with the otoscope. Everything looks symmetrical. You don't have any discharge or anything. You don't have any nodules or disformities, no skin tags or anything. I'm going to put these gloves on. Take a look at your ears. Alright, and now what I'm going to do is, it's called the whisper test. So what I'm going to have you do is put a finger and kind of occlude one of your ears, and then I'm going to say a combination of letters and words in your other ear, and I'm going to have you whisper them to me. So I'm actually going to come over on this side.
So cover this one?
Yeah. Okay. Okay, will you repeat those for me?
A, B, C, 2, 5.
Okay, other one.
A, B, C, 2, 5.
Okay, perfect. Okay, now what I'm going to do is this is a tuning fork, and I'm going to knock it against the surface and it's going to ring. I'm going to put it on your bone right here, and then I'm going to put it up to your ear. We're going to do that on both sides, and then I'm going to put it up on top of your head, and you're going to tell me when you stop hearing the noise, okay? Sorry. Just messed that up. Put it on top. You're going to tell me if you hear it more in one ear than the other one.
Yeah, I hear it more in my right ear.
In your right ear?
Yeah.
Okay, now cover your right ear up. Now, which one do you hear more?
Still kind of my right ear.
Okay, now cover your left ear.
Well, I think maybe do it again because I can't hear it.
Okay, cover your left.
Oh yeah, I hear it in left.
Okay. Alright, now your mouth and your nose. So, do you ever have nosebleeds, sinus infections?
Only when I'm like sick or
Okay.
have a cold or something.
No obstruction, you don't have discharge, you don't have an issue with sense of smell or taste. Do you have allergies? Alright, your nose is symmetric, there's no deviations. Can you tilt your head back for me? Yep, no septal deviations. Doesn't look like you use your nose to breathe, you're not nasal flaring, you don't have any skin lesions. I'm just going to feel your nose. Ridge. Okay, feels good. No masses. And it's not tender when I touch it at all? Okay. And it looks good, no swelling, no drainage at all. Now I'm gonna, your sinuses, so you have your frontal and then your maxillary, and they don't look swollen to me, but I'm just gonna tap them and see if there's any tenderness. So do you feel any pain or tenderness?
No.
No? There?
No.
There?
No.
Okay, perfect. Alright, and you don't, in your mouth, you don't have any sores or lesions?
I have a canker sore.
Oh yeah, you said you had that?
Yeah.
Where is it?
It's like right here.
Okay, so on the lower right of
Yeah.
your gum? Okay. Have you experienced a sore throat recently? Hoarseness, change in voice? When's the last time you went to the dentist?
Probably like last year.
Okay. So like 8 months ago.
Yeah.
Okay. You have no bleeding gums or swelling of your gums. No chewing difficulty. And you haven't had any teeth removed.
No.
No. And you had braces.
Yeah.
For how long?
A little over a year.
Okay. And have you had your wisdom teeth removed?
Yeah.
How old were you?
20.
Okay. And you had all 4 of them taken out?
Yeah.
Okay. But how many fillings do you have?
Probably like 6.
Okay. But no caps or... Okay.
Just fillings.
Okay, perfect. So now I'm just going to take a look in your mouth. I'm actually going to use this light also. It's kind of going to be annoying to have to do this, but so your lips look symmetric. They don't look chapped or overly dry or anything. Your mucous membranes are pink. Can I have you just put your tongue on the roof of your mouth? I'm just going to look ready and open wide. Perfect. All right. And you said you had no teeth removed, so I'm guessing you have around 32 teeth. Your tongue, can you stick it out for me? Okay, and I'm going to just kind of, sorry, this is probably going to be uncomfortable for you. Move it around, look. There's no masses or anything. And there's no tenderness when I touch it? No pain or anything at all? Okay. Let's see. Can you move your tongue for me? Move it around. Perfect. And then will you stick your tongue out and then look up? I'm just going to look at your hard and soft palate. Okay, and then I'm going to stick this in the back of your tongue. Kind of depress your tongue and look at your tonsils and your uvula. Sorry if this makes you gag a little bit. I actually am going to test your gag reflex. There you go. Perfect. And then can I just have you clench your teeth and smile? And let me just look at that canker sore real quick too. It's about 2 centimeters in diameter. It looks pretty irritated, white and red and swollen. So we'll talk more about how you can treat that in a minute. But do you have any other questions or any concerns or anything?
No.
All right, thanks so much.
Yeah.